A small amount of SMN protein is produced from a similar gene called SMN2. This gene makes several versions of the SMN protein, but only one version is functional and the other ones are smaller and then easily degraded. Normally, each cell has two copies of the SMN1 gene. About 95% of individuals with spinal muscular atrophy have mutations that delete a section called exon 7 in both copies of this gene. As a result, little or no SMN protein is made. In about 5% of people with this disorder, one copy of the SMN1 gene has a deletion of exon 7 and the other copy has a different mutation that disrupts the production or function of the SMN protein. The SMN1 gene is located on the long arm of chromosome 5 at position 13.2. While the cause of neuronal death is unclear, it is the loss of motor neurons that leads to the signs and symptoms of spinal muscular atrophy.
Since there is no cure for spinal muscular atrophy, palliative care is a patient's only option. The care is symptomatic and main areas of concern are orthopedics, respiratory, nutritional care, mobility, cardiology, and mental health. Various surgical procedures such as spinal decompression are done to alleviate pain from orthopedic problems. Other forms of physiotherapy and occupational therapy have also been shown to benefit many patients. Non-invasive ventilation is frequently used to assist with breathing. Various technologies assist in managing movement and daily activities, and in severe cases, a feeding tube may be necessary.
With proper physical therapy, the survival time for those with type 1 spinal muscular atrophy is within 2 to 3 years. Since type 1 is the most severe, the survival time of type 2 is typically longer, while type 3 SMA may allow survival until early adulthood. Without proper therapy, contractions of muscles and tendons around the spine can cause scoliosis and worsen the breathing of the individual, leading to earlier death. Current research focuses on gene therapy, stem cell therapy, and SMN2 activation as potential ways to treat patients with SMA. Gene therapy attempts to use a viral vector to deliver the correct SMN1 gene to the cells where it can be expressed. Stem cell therapy aims to inject stem cells into the spinal cord, which will develop into functioning motor neurons that produce functioning SMN1 proteins. Activation of SMN2 aims at increasing expression of this gene to counter the loss of SMN1 and increase the overall amount of SMN protein in the cells.